Did you know that consuming high amounts of sugar may contribute to the development of worsening of asthma symptoms in some individuals? One study published in European Respiratory Journal found that people who consumed more than 5 servings of sugar-sweetened soft drinks per week had a higher incidence of asthma and chronic obstructive pulmonary disease than those who consume fewer than 1 serving per week. Another study published in the American Journal of Respiratory and Critical Care Medicine found that high sugar intake was associated with poor lung function and a higher risk of asthma in children. While the relationship between sugar consumption and asthma is not fully understood, and more research is needed, it is important to remember that asthma is a complex condition with many potential triggers. If you or a loved one has asthma, it is important to work with the healthcare provider to identify and manage potential triggers, including dietary factors like sugar. Did you know that consuming high amount of sugar may worsen symptoms of seasonal allergies in some individuals? One study published in the American Journal of Clinical Nutrition found that high sugar intake was associated with increased allergy symptoms in adults. The study showed that participants who consumed the most sugar had higher levels of allergy-related inflammation and were more likely to experience nasal congestion, runny nose, and other allergy symptoms. Another study published in the journal Clinical and Experimental Allergy found that consuming food high in sugar may increase the production of certain immune cells that are associated with allergy symptoms. So it is important to remember that diet can play a role in managing allergy symptoms. Reducing sugar intake and consuming a balanced diet rich in fruits, vegetables, and other nutrient-dense foods may help to alleviate symptoms of seasonal allergy in some individuals. If you suffer from seasonal allergy, it is important to work with the health professionals who can help you identify and manage potential triggers, including dietary factors like sugar. Did you know that consuming high amount of sugar may increase the risk of stroke in some individuals? One study published in the Journal of American Heart Association found that people who consumed more than 1 sugary drink per day had a higher risk of stroke than those who consume fewer than 1 sugary drink per week. The study also found that individuals who consumed a diet high in added sugars had a higher risk of stroke mortality. Another study published in the journal Stroke found that high sugar intake was associated with an increased risk of ischemic stroke, which is caused by a blood clot in the brain. So it is important to remember that diet plays an important role in overall cardiovascular health. Reducing sugar intake and consuming a balanced diet rich in whole grains, fruits, vegetables, and lean protein may help to lower the risk of stroke and other cardiovascular diseases. If you have concern about your risk of stroke, it is important to work with a healthcare provider to identify and manage potential risk factors, including dietary factors like sugar. Did you know that consuming high amounts of sugar may increase the risk of developing Alzheimer's disease or other forms of dementia in some individuals? One study published in the New England Journal of Medicine found that higher glucose levels in the blood were associated with an increased risk of dementia, including Alzheimer's disease. Another study published in the Journal of Diabetology found that individuals with type 2 diabetes, which is often linked to high sugar intake, had a high risk of developing dementia. So it is important to remember that a diet plays an important role in brain health. Vegetables, whole grains, and lean protein may help to lower the risk of Alzheimer's disease and other forms of dementia. If you have concerns about your risk of developing Alzheimer's disease or other forms of dementia, it is important to work with a healthcare provider to identify and manage potential risk factors, including dietary factors like sugar.